right? So let us understand what is gestational diabetes. Okay, gestational diabetes is reversible and can be prevented. Okay, so what happened is that, during pregnancy, right? So for the pregnant mothers, there will be this hormone that will be made by the placenta, which will actually prevent the body from using the insulin effectively. All right, so causing this thing called the insulin resistance. Okay, meaning that they can produce, okay, the pancreas can produce the insulin, but the body cannot produce it effectively. And this usually occurs between 24th and 28th weeks of pregnancy. And for gestational diabetes, right, it accounts for about 2 to 10% of pregnancy in the United States. And the high risk cause for this, the major risk cause for this is actually obesity. So how does a pregnant woman know that, she is overweight? So we can actually follow this by World Health Organization, this BMI standard range. Anything that is above 25 is actually overweight. Okay, and the BMI above 30 is already obese. All right, so over here, maybe I would like to share a bit more. Many people have a concept that, mothers cannot exercise when they are pregnant as it increases the risk of miscarriage. Okay, this is not true, all right? In fact, exercise helps to lower the miscarriage risk. Imagine a pregnant mommy, right, not exercising for 10 months and thinking that, they have to eat for 2, they may end up overeating. So if let's say they eat all the high-fat, high-calorie food, I think it is very easy to put on weight and even eventually become obese. Okay, so what pregnant mommies really need are like nutritious food to actually boost their immune system. And it is very important for them to keep their weight in check because, like I mentioned, obesity increases the risk of gestational diabetes. So gestational diabetes also has several health impacts on newborns as well. So let's take a look at the first point here. Actually, there will be an excess growth of the baby that is more than 4 kg. And this will actually increase the risk of injury during delivery by the mommy. Okay, and also the newborn may experience low blood sugar. Okay, what happened is that, after delivery, right, the baby, although already left the mother's body, but the baby continue to have a high insulin level, thinking that, it needs to actually neutralize the glucose level, but it no longer has the high level of sugar from its mother already. So a newborn may experience this low blood sugar, and some newborn babies may have like jaundice, seizures. And also what is more worrying is that these newborns may have increased risk of type 2 diabetes in the future. Okay, so many people think that, gestational diabetes only occur like during pregnancy, right? But it has a huge impact on the mother later on, like hypertension, okay, meaning high blood pressure, and this proteinuria. Okay, this is a high level of protein in the urine, affecting the eyes as well, visual impairment, swelling in the face, abdominal pain, and even difficulty in delivering with a higher chance of C-section. And also experts, have pointed out that half of those, okay, who have diabetes, okay, will move on to develop type 2 diabetes after 5 to 10 years after their delivery.